for stenosis. Okay then. Stenosis L34, L45, L5S1. So that's we see the problem. I found probably 3 problem. Okay, the osteoporotic bone, and then you have to check by BMD test because osteoporotic bone also sometimes give pain. Sometimes.
The bone itself.
Sometimes give pain. And then also the stenosis of the lumbar 3-4 L5S1.
That's like the sharp edges.
Yeah.
It changes shape instead of being uniform. Rounded.
L5S1 actually right side, left side also gets smaller, but all the same with the L34 also pinch. Right side, left side pinch totally, but you feel only on the right side.
That's right.
Yeah. So we have to first, you have to check also the bone marrow density test.
Okay.
Yeah. In Professor Murah, the tools only there in Bali.
Where?
Professor Murah Hospital in Sangla,
place.
in the same place.
Yeah. Okay.
Only tools there. Actually, that's place you can finish everything. They have the tools because Professor Murah Hospital is the highest hospital in Bali.
Okay.
The one and only type A. Here is type C.
I see.
The highest is type A.
Is that why it costs 11 million instead of 4 million
For
to
that?
get my MRI?
For the MRI?
Yeah.
How many?
It was.
How much is it?
4 million here, 11 million there.
4 years. Oh, maybe because of the Tesla, yeah?
The which?
The Tesla. The Sangla Hospital, the Pura-Pura, the MRI is the best in Bali. 3 Tesla.
Okay.
Here, half Tesla.
Oh, okay.
In my other hospital, Siloam, Bali Mandara, 1.5 Tesla. Sangla is 3 Tesla, the highest.
Is the quality of
The quality picture like that, very good. So it's very easily to catch the problem.
Okay, good.
Because it's very good quality. Then that's the problem. We have to make sure where is the source. So usually I do injection technique for diagnostic. We inject one by one, which is you are fully alert.
Which
you are fully alert. I only put the local, the numb medication, and put the
that's so that during the test you can see is it a radioactive, or you're just doing it for pain. What is this injection?
So the injection is for this cortisone injection. Also consists of the numb medication to block the nerve.
Right.
To block the nerve, is it right there causing the pain or not?
Oh, so that's where today, for the first time, Dr. Dini had said sometimes you would do a cortisol injection that sometimes would have a long-term effect. And then during that time, it would be possible to focus very carefully on building up muscular strength around that area that might help stop the pain.
So now the injection main function is for the pain, for the diagnostic, to confirm where source of the pain. But is it enough to reduce your pain or not? Don't know.
It's a test.
Yeah, it's just a test. As to looking where is the pain come from.
Do you suggest
L34, L5S1, like that.
Do you suggest we do that now?
I cannot.
Okay.
Because we have to perform that in the surgery room.
Okay.
Yeah, so I have to rescheduling my.
Okay, I didn't know when she said, "Oh, it's possible to see you today."
Yeah, for see me today is possible, but
progress.
for the
To
injection, I need to manage my time, my schedule.
Of course.
Yeah, I have the type.
I thought it was remarkable that we got to see you this quickly after seeing her.
Yeah, that's it. Now you understand, yeah?
Oh yeah.
What's probably the causing?
Sure.
That usually also, firstly before, I usually never do directly to injection. I always try, don't touch our body first. Don't put anything inside.
Sure.
So you are very good in exercise.
Yes.
keep do the exercise, but maybe you have to modify it.
And that's what I'm trying to figure out.
Yeah.
Where do I
Because-
get that kind of instruction? I do.
I'm not a fan of yoga because yoga is good, very good. Yoga is good,
Mhm,
but we have to manage which yoga movement is good
Of
for
course,
you,
of
which
course.
yoga movement is good for you.
That's-
For me, that's what we have to
Uh-huh.
know. Forward
Right.
bending, I totally not agree
So
because 300% of the weight of the loading,
Mhm.
300% when you do the forward bending on your lumbar.
Yeah.
So your lumbar will got the weight 300%, 3 times more. Can you imagine? It will break easily, early.
Yeah.
So we have to modify.
So then the question is, if there are exercises to do flat on the back,
Yeah.
which you mentioned,
So
which
so
is like
I
crunches.
always try, or I always tell, what is the function for somebody to do forward bending?
Mhm.
What is the function? What muscle you want to exercise? What muscle you want to train?
Right.
Is there other movement?
Exactly.
Exactly.
Of course.
There's many movement to train one muscle,
And
isn't it?
so-
Many variation to treat one muscle. So we choose the safe one for you.
and
Never do forward bending. Absolutely.
so
Absolutely.
like crunches
Like crunches.
from my back. Yeah.
Crunches or we bring the leg up.
Okay.
Okay. So
And-
you have to modify it. No more forward bending. Keep your back straight, and then do physiotherapy. So the first modified activity is the most important.
Mhm.
Do all your activity without forward bending. Perform physiotherapy, and then
What
start
I didn't understand your pronunciation.
physical therapy.
Okay.
Physical therapy,
Okay.
and then start to take some medication, oral medication.
And the physical therapy is from whom, where?
Oh, here we have
Okay.
the specialized also here, so I
Okay.
will consult to her,
Okay.
and then the most important, modify your activity. No
Mhm.
more forward bending. Keep
Okay.
your back straight.
Mhm.
If you want to clean your leg, you have to bring the leg nearly
Up.
to arm,
Yeah.
or sitting will be better. So you can take shower and then
Mhm.
clean the leg with the back like this,
Right.
and then use your shirt in sitting position,
Yeah.
not in this
Right.
position.
Okay.
Yeah? You have to start from now.
I-
Not
I-
only for you, but also the nurse. If hear me explain the patient, then we have to change.
Right.
Keep our back straight.
Okay.
Yeah, and then strengthening this core muscle.
Yes.
That's it.
Which I'm doing.
I
a lot
always
of.
I always try don't touch our body.
Yeah.
Yeah, naturally, usually
It's designed.
80% works.
Yeah. It's a beautiful system. It's well designed.
You're right.
We're living this bizarre lifestyle.
You know already,
Yeah.
okay? But just need some advice like that.
So even with the damage that's happened to the spine, now the pinch on the nerve, all those things, you think.
The pain can decrease, not totally gone.
Uh-huh, uh-huh.
Not totally gone.
Mhm.
The pain can decrease.
Yeah.
That's it.
Okay. And in the end, if nothing else, or some pain remains, there is surgical means to actually repair some of these problems?
Yeah. Later. The last answer is
last
surgery.
resort, yeah.
Last answer.
Understood.
That last answer.
Okay.
We have to try the step and then what
Sure. Of
usually
course.
works. Okay?
Yeah, always.
Very good.
Okay.
Very good. Okay.
So-
Consul physio, Dr. Pasela ya.